A county commissioner's view on hydroxychloroquine he likely wouldn't be paying much attention to if she wasn't also on a health district board. And with mask mandates closing non-essential businesses, all of that happening over the last 5 months, more attention has been brought to Idaho's 7 health districts than probably in their entire existence. Here's how the districts break down across the state. Each district has its own board made up of a county commissioner from each county and that it represents, and it also has on it at least one physician. And all members, according to state code, shall be chosen with due regard to their knowledge and interest in public health, a sentence that has been thrust into the spotlight lately. And with so much attention on health districts these days, we set out to learn more about their history. Here's Kim Fields.
Idaho's 9th legislature first established the State Board of Health in 1907. Governor Gooding signed the legislation that created it.
That's really when Idaho kind of got on board, you could say, with the idea of state public health services.
State historian Hannah Lori Hine said the State Board of Health wasn't created in 1907 in response to a particular disease or cause of concern. It was just part of developing a state government. The idea for local or county-based health organizations didn't come about until the early 19-teens, when the State Board of Health started to expect counties to pick up some of the work.
And they were supposed to provide those public health services, which at the time included everything from trying to manage communicable disease to managing and regulating the delivery of fresh milk and looking at the containers that milk was delivered in, to water and sanitation purposes.
The only problem, most Idaho counties struggled to do it, with the exception of Twin Falls County. Interestingly enough, because they were dealing with a highly contagious disease.
In the late 1920s, Twin Falls County was experiencing a severe and devastating meningitis outbreak. They developed this county department, essentially, and they had full-time staff, and they had nurses and doctors to try to get the disease under control.
By 1935, the federal government stepped in and highly recommended other counties follow Twin Falls County's approach to ensure a public health service for every Idahoan.
It really took kind of that federal, not oversight, but investigation to help create a roadmap for how we were going to continue to develop these county-level services and programs.
Over the years, several more county-level health departments popped up, but still, not all counties were complying. Hine found state documents from 1967 talking about the deficit. She read us one of the quotes.
Under the existing state law relating to county boards of health, only half of the counties up to the present time have organized full-time local health departments, and many of the remaining counties have never complied with state law. It was very clear that not every Idahoan was being delivered the kind of public health service that kind of was mandated.
The state, realizing that, created through legislative action the structure of what we now know today as the 7 health districts. They were formed in 1970.
Decisions made 30, 40, or at this point more than 100 years ago are still impacting our day-to-day lives now. And so any opportunity people have to better understand the past, it'll help us make better decisions now and be able to envision a brighter future.
So what can we learn from the history of the 1918 Spanish flu pandemic that could help us respond to COVID-19 today? Well, unfortunately, Hannah Lori says there's not a lot of documentation on that because of budget issues at the time. The State Board of Health didn't have the funding available to print their annual report from 1918. The only records that exist are from board meeting minutes, and Hannah Lori says those are less than 1 page long. You know the old saying, right? Those who do not learn from history are doomed to repeat it.